Thanks, Curtis. Local 12 News and our Sinclair sister stations have been soliciting your questions about the healthcare exchange rollout this week. So we asked National Correspondent Kristine Frazao to find answers to your questions.
From Oregon to Maine, from Utah to Florida, the questions we're getting range from how do I to how could they.
From Magna, Utah, and a viewer of KUTV, Peter asks, I am unemployed. How do I pay for health care? For that answer, we spoke to Mary Agnes Carey, senior correspondent with Kaiser Health News.
There will be subsidies to help people who fall into certain income guidelines. It's 100% to 400% of the poverty level.
For an individual, that's an income of between $11,500 to about $45,000. The next point is from Michael in Freehold, New York, and WRGB-TV. He says, quote, I don't understand how the House and Senate pass a law they didn't read and then exempt themselves from the law, but make it mandatory for everyone else. It's a good question, but only partially correct.
The law requires members of Congress and their personal staffs to purchase on the health insurance exchanges. But the rest of Congress doesn't have to do that.
So those exempt are members of committees and other staff. The next pair of questions comes from viewers of WPEC in South Florida. From Stan in Bryant. He asks, how can the president blame Republicans for a shutdown of government when he and Senator Reid refused to negotiate? Well, in Washington, it's a blame game from both sides.
Harry Reid has said, whatever you do, I won't talk to you.
But the president says he is willing to negotiate with both Democrats and Republicans, just not over a law that has already been implemented.
The Affordable Care Act is a law that passed the House, it passed the Senate, the Supreme Court ruled it constitutional. It was a central issue in last year's election. It is settled, and it is here to stay.
And finally, Patrick in Dewey Beach asks, will the subsidies paid to individuals for the Affordable Care Act be considered taxable income? The short answer for that is simply no.
We're going to continue to take your questions, and I'll be back tomorrow with more questions and answers from across the country. In Washington, I'm Kristine Frazao reporting.